Good afternoon, Dr. Stefas. It's so nice of you to join us today.
Thank you.
So we've come a long way in our fight against COVID-19. I remember, you were instrumental in my vaccination process. So thank you for that. But today we want to talk a little bit about the treatments that are out there for mild to moderate cases of the virus. So when someone has COVID, what can or should they do for symptoms?
In terms of COVID, the good thing is that the majority of patients today are receiving COVID with mild symptoms. These mild symptoms consist of fever, chills, cough, fatigue, sore throat congestion, typical things that you may see with either the flu or that you may see with a common cold. And the goal is that if you're experiencing mild COVID, you should really stay home to minimize the exposure and get tested. But with that, there's also over-the-counter products that you can use to help you during this period of time. Now, the thing to keep in mind is the over-the-counter products that we're going to discuss today doesn't actually fight against the virus or treat the virus. What it does is it makes you and your body more comfortable as you fight off the COVID-19, virus. So that's really important to note, and a good majority of the people can go ahead and do that without any other further intervention.
What are the ones that you can go to the store and buy over the counter?
So it's very similar to what you would get if you had a cold or a flu. You can pick up acetaminophen or ibuprofen, which is also known as like Tylenol, Motrin, and Advil. Those products could be used for body aches. It can also be used for fever, as that's one of the symptoms that you would want to focus on, particularly fever for mild COVID, to make sure that you keep that in check. You can also take lozenges for your sore throat or use a vapor rub for your congestion. So, you would understand what your symptoms are, and then from there you would pick up a remedy within the local pharmacy to resolve those symptoms as your body's fighting off the virus. I wouldn't load up proactively on a lot of different over-the-counter medications because, as you know, COVID can exhibit differently within different people. That you would just get a good understanding of what that is and try to meet them, particularly if they're mild symptoms.
Dr. Stefas, it sounds like there are a lot of treatments on the market to treat COVID-19, both for non-hospitalized patients and for hospitalized patients. I wonder if you could talk us through some of these treatments.
Sure, I'd be happy to. So when I think of COVID, I break it down into a couple of different categories. I look at it as mild COVID for fairly healthy people that will resolve on its own. And then from there, you would typically pick up over-the-counter items just to make yourself comfortable as you go ahead and you start fighting off the infection. You then have prescription items like Paxlovid and molnupiravir, which are oral antiviral medications. And what they do is they stop the replication of the virus. Typically, if you talk to a provider and you're over 65 or you have other comorbidities like diabetes, COPD, cardiovascular disease, immunocompromised, providers will typically write for these agents to reduce the chance of it progressing to severe COVID and requiring hospitalization. It is free of no charge today, and a lot of times the pharmacies will even deliver it to the home. But with that, you do need a prescription, so you do need to talk to a prescriber most of the time in order to get that product, which would then be prescribed to the pharmacy and then sent to your home. Paxlovid or Paxlovid has been actually really good because even during all the various different mutations, variants, and iterations of COVID, it still remains highly effective. And the goal is to get on treatment within 5 days of symptoms.
And how effective is it?
So it's up around 85 to 90% effective if you take it, as soon as you test positive or you start to exhibit symptoms. You take it over the course of about 5 days. And when we mean effective, we mean reduces the potential for hospitalization.
Most consumers have heard about Paxlovid, but I wasn't aware of this antiviral, but I read about it. Molnupiravir. When would you use that versus a Paxlovid?
Okay. Great question, Sandra. So molnupiravir is another antiviral medication, has a little bit of a different mechanism of action, but it's not as effective as Paxlovid. So Paxlovid is usually the first line of treatment. Now with molnupiravir, however, it has much less drug interactions. So there are a certain number of drugs that if you're on them, you can't take Paxlovid, but you can take molnupiravir. So, if Paxlovid is not right based on the other medications and other things that you have going on, there is an alternative, molnupiravir. But unfortunately, it's not as effective, but it's better than not taking anything at all.
When should I take Paxlovid?
So basically, Paxlovid needs to be taken the moment that you test positive. There's been studies show that the earlier you take the Paxlovid, the better that it works. Because what it's doing is it's reducing the replication of the virus. So the less virus in your body, the more you can attack those and the less replication you get, and the quicker your body can fight off whatever is remaining.
Oh, that's good to know, because I get this question all the time from my friends who test positive and they're like, well, I'm feeling fine right now and I don't know if I should take this Paxlovid. But, thanks for that information. I'll tell them to get right on it.
Right. And if you're really bad, if you wind up in the hospital, what can be done inside the hospital?
From there's another antiviral on the market called remdesivir. And remdesivir is typically used for hospitalized patients. Similar to Paxlovid and molnupiravir, but it's in the IV form. And you can get it in an outpatient setting, but you would need to get it as a infusion 3 days in a row in an outpatient setting, or in more severe cases, hospitalized. There are multiple options out there for patients in order for them to get treated and get better. It's really important to understand and appreciate the different variants that are out there and the new variants that are coming, because a lot of that really does go into consideration in terms of what treatment options you're going to use. So, for example, the monoclonal antibodies are no longer authorized to be used. And that's basically based on the new variants that are out there today, that those monoclonal antibodies are having a hard time detecting the COVID-19 virus within your body. Because when those mutations or those variants occur, they occur on the spike protein, which is the sticky part that comes out of the virus. And that's what these monoclonal antibodies are using to identify COVID and then ultimately kill the virus. When you're talking about these antivirals like Paxlovid, molnupiravir, or remdesivir, those actually reduce the replication of the virus, mostly by attacking an enzyme. And that doesn't change, right? So even as COVID is mutating, that part of the virus that results in the replication of the virus is unchanged and continue to be targeted. And that's why you're still seeing good numbers of efficacy as it pertains to Paxlovid, molnupiravir, and remdesivir. And that's why those continue to be the drugs of choice.
We have all these variants, they just seem to pop up, it seems like weekly. And I think you mentioned this before, but I just want to be clear. Does Paxlovid work against Omicron and all its subvariants?
Yes, Sandra, it does, because it actually targets the enzyme that results in a replication of the virus. And that doesn't change with the mutations or the change in the variants, that it remains effective even throughout all these various different variants that you're hearing about.
And what about the other antiviral drugs?
Yes, it would be the same for them as well. So for the molnupiravir and the remdesivir, once again, because they're antivirals and not the monoclonal antibodies, they continue to remain their effectiveness based on their mechanism of action of focusing on the replication of the virus, not actually killing the COVID-19 that's circulating in your body.
We know Paxlovid is effective, but physicians are only prescribing the drug in 13% of new COVID cases in the United States. Dr. Stefas, what can be done to get more people on Paxlovid to help fight off COVID?
I just think it's continued awareness and greater education. It's interesting because when Paxlovid first came out, it was very little supply, right? So it was a tremendous demand and a little supply. So, it was embedded within the prescribers and other folks that, you should really only use this in the patients that have the potential to be the most sickest that are out there. Now that we do have a very good supply where there's more supply than demand, it's important for us to understand that any patient where the benefit outweighs the risk should really be considered for Paxlovid. And I think as people get more comfortable with the product and people really understand the nuances between those things, I'm hopeful that there'll be more and more uptake of the product, resulting in less hospitalization and overall less death.
Awesome. Well, you mentioned awareness, and on 20-Minute Health Talk, that is our goal, to raise awareness and to educate our audience. So thank you very much for joining us today.
Great. Well, Sandra, thank you so much for having me today as well. And it was an honor to participate in your vaccination. And I want to thank you very, very much for being that person, to receive the vaccination and really being a tremendous advocate and support for COVID vaccinations and treatments and everything that you do. So it's an honor and pleasure to join you today, and just wanted to thank you for that.
My pleasure.
So Sandra, that was a great conversation, and it's great that we learned so much today about there's such a supply of this Paxlovid. So if we did get COVID, we know there's something that we can do to lessen the disease and hopefully be feeling better quicker.
Yeah, Rob, that was a fascinating conversation with Dr. Stefas. And something else that he said that was encouraging is that Paxlovid in particular is effective against the many variants and subvariants that we seem to see weekly these days.
In the beginning of this pandemic, we're talking to Dr. Kevin Tracy, who's the president of the Feinstein Institutes for Medical Research, and he talked about how important it was to get treatments just like Tamiflu for the flu. And the Feinstein, also working with Cold Spring Harbor Laboratory, have really been out in the forefront of trying to do research to find new treatments to take care of COVID if you do get COVID.
Right, because hospitalization cannot be the go-to. As we've learned today, for mild and moderate symptoms, these can be treated at home.
Yeah, which is great. And also, too, that you could just, have it delivered from your pharmacy. And for the Paxlovid, it's free.
What's important and what I want our listeners to know is that the sooner you start the drug, the better you will feel.
Well, I thought there was a lot of great information in there, great conversation. And thank you so much for tuning in and listening to 20-Minute Health Talk. I'm Rob Hoyle.
And I'm Sandra Lindsay. Thank you for listening.